Hi there, it's Manda here. How did a psychologist heal a whole hospital of criminals, potentially criminally insane, very mentally ill people without conducting a single therapy session or a single case review or any meetings, anything, no kind of clinical patient contact? Well, that's what I'm going to look at in this video. Zero limits, got to get it in the shot. Zero limits. The secret Hawaiian system for wealth, health, peace, and more. Tells the story of this. Now, I bought this book. It's by Joe Vitale, and he's from The Secret. He's done various books, such as The Attractor Factor, really famous books, and he's quite prolific in his hypnotic marketing, I think he calls the company. So I am fairly well versed with his material, but I'm not a huge fan. I mean, The Secret, as we know, has got some massive downsides. It's not complete information. So although it really excited me when I saw it back in, I don't know, 2006, maybe 2007, not sure, to think that that was coming out as a big media event. Actually, it's fairly limited. So put that to one side about The Secret and Joe Vitale. This book I read back in 2007 when I first got it, and for some reason it kind of jumped off my shelf a week or two ago, and I thought, give it another go. So hooponopono, most people have heard of it. Most people know that it seems to be a random bunch of statements that you say. Actually, the order is, I'm sorry, please forgive me, thank you, I love you. And so I read this, 2007, back when it came out, and it was okay. You know, it's just another of the books that I read. I read a lot of books, read a lot of books. So all well and good. And I think I had a little go with the Hooponopono. In fact, I bought a DVD or a CD as well with some of the chants on. Back then, there wasn't so much to download off the internet. Besides, back in 2007, I was a very busy mum with a 1-year-old, a 6-year-old, and an 11-year-old who just moved area. So really, really busy. So I did what I could, but I never really took to it. And I think that that's partly because I was too busy, didn't give it time, and also because as a therapist, the whole kind of premise probably bothered me a lot. The idea that you could do this work without seeing people, because I'd already been a therapist for 10 years by then, and I had to see a lot of people. So I think there's something about that I was a little bit resistant to. Also, don't forget, there's the fact that in therapy, when you're training to be a therapist, and for many people it's several years to get to that point of being qualified enough to be able to be in paid practice. Lots of people do lots of volunteering in therapy, but to get into paid practice, there's a fair bit of competition for the work, and it's not an easy ride necessarily. But there's a big belief, a big kind of rule almost in therapy training that, and I was a trainer of therapy for many years too, so I've seen this from both sides. But the big belief is you have really good boundaries, because when you're in the session doing the work, you're sharing your ego states to some extent. You're lending people some of your ways of managing emotions and structuring them. Also, lots of an empathic exchange. It's a massive energy exchange, basically, which is why many therapists get to the point of burnout. It's really, really common as a problem. I think we all know that. So one of the main premises that therapists are taught pretty much right off the blocks is be boundaried, protect yourself from burnout, and do not take too much responsibility. For example, if you're in a session with somebody and you realize, or you get a huge sense that you're working much harder than they are, chances are you're doing too much and you need to pull back, let them do more. That's just a simple principle that keeps people able to function in the job for a long time and doing as much good work as possible. So that was the main problem I had with this method, I think, and this theory, and not that I had time to process it especially well then, but it was this idea that everything is your responsibility. So if you come across a problem in your life, whether it's a bad driver on your daily commute, or a rude person as you're walking into a shop and they sort of slam a door in your face, or indeed a whole ward of psychiatric criminal patients / prisoners, because that's the people that the book was written about with the psychologist. The idea of taking responsibility for that, I think, was a little bit of a step too far for me, so I kind of couldn't get my head around it. Anyway, the book is, as I say, by Joe Vitale, and in it he details the work of Dr. Hugh Len, who was this Hawaiian, Ihaliakala Hugh Len, PhD, this Hawaiian psychologist. He may be a psychiatrist, I don't know. A lot of people don't know the difference between the two. Quickly, just to let you know, a psychologist would generally look at psychology in terms of their behaviour and perhaps give them therapy, and often it's cognitive behavioural therapy, and they'll be looking at it from that sort of psychological viewpoint, as well as they do lots of tests and personality measures and that kind of thing. A psychiatrist is principally a doctor of brain medicine. So a doctor who is familiar with the kinds of medicines that you might need if you're having a psychotic episode, or if you've been medicated for bipolar, or any of the major depressive disorders and anxiety disorders. Really, people who are really struggling will have a psychiatrist. And you often see or hear people complain, oh, my psychiatrist is rubbish, they don't do any therapy with me, they don't give me any help, they just dole out drugs. Yes, that's what they do. That is their job. It's to review your case and to, well, I'm going to stop because I might get a bit sniffy about it. They review your case and they dole out the medications deemed appropriate. They will then perhaps review those and maybe change them if they don't seem to be helping, or you've had to get in worse. So they don't give therapy. So I'm not quite sure really what this guy was. Obviously it's in Hawaii, and in America it might be a really different situation to what we have in the UK. So 15 years later, I pick up this book and I think, okay, let me have a go again. And I start to clean. And the book is about cleaning. It's about saying these words. I'm sorry. Please forgive me. Thank you. I love you. And it's about saying these words, not really to a person out there, but to your own self, but to the divine, even though it might be prompted by an interaction you've had with a person. So say you have an argument with your other half. The idea with this book is that's your responsibility. Now this is radical, this whole idea is radical, to take responsibility for other people's behaviour. It sounds like exactly the opposite of what we try to help people with when they're involved in dangerous, damaging, narcissistic relationships and that kind of thing. And certainly lately how it's been with the state. So it's really radical and uncomfortable and unfamiliar, but I had a go, and I was quite staggered, because the idea is that you say these 4 statements as often as you can, and what you're doing is you're cleaning. You are allowing the linked memories, because that's what is running at the time of any incident that's happening. It's programs and memories, and this I can relate to. This is standard stuff for a psychotherapist. Perfectly fine with that. But you're allowing those, you're working on the basis that if these memories have emerged in your external world, that means they're in your internal world too, because you can't attract something that you don't resonate with. And there is in fact no external world, according to this Hawaiian philosophy. So saying these words to clean and clear something within you is thought to be the secret. So that's what the psychologist, Dr. Ihaliakala Hugh Len, PhD, did when he was in this Hawaiian hospital. And there are so many comments and statements from other people to prove and to indicate that, yes, in fact, he did move a ward from being full of dangerous, aggressive people, staff leaving left, right and centre, really bad vibes altogether. Even the paint wouldn't stay on the walls. It was that miserable and negative of a place. And he turned it from that, allegedly, according to the people who witnessed it, into something where people had their shackles removed, people had privileges, and the violent incidents stopped. And they went from having a staffing crisis where they couldn't recruit and people were always off sick to having too many staff because all the patients / prisoners improved in some way, got better and moved on. So what he did apparently worked for him, which is of course why the premise is so interesting, because it gets you thinking, oh, I wonder what it could do in my life then. So what I've learned is that it seems to appear in strange ways. I'll tell you what I did with it. I wasn't planning to do anything with it. I was just clearing as often as I could remember saying the words in the last week. And then 2 days after I'd started that, I had a bit of a discussion with my younger daughter, who had gone away, lost her driving license, didn't know where, when or how. And this has been a bit of an ongoing saga, and it's linked to another massive ongoing saga about her driving test. And of course, we need the license for the test. And the test has been a massive saga, and I won't go into it, but it's a huge story. And I feel like, you know, it's quite a scandal really the way that things are in the UK at the moment with this, but put that to one side. So I was a bit tricked, and I had a bit of a harsh word and a bit of go. And I don't usually do that. I'm usually pretty chill, and I don't throw blame around. And I certainly don't like making other people feel horrible and judged and miserable. And, you know, it wasn't that extreme maybe, but nevertheless, I knew I had done it and I didn't like it. But my frustration popped out. So I cleaned on it. I cleaned on it that evening, just for a short while. I don't know, 10 minutes. Then I forgot about it. And then the next day, she appeared with a beaming smile on her face. Mummy, a miracle has happened. I'm like, oh yeah, thinking it was going to be something linked to her friends, you know, some silly thing that was fun or whatever. I found my driving license. I never took it with me. Here it is. And I was like, wow, that's amazing. That's just amazing. So that might seem like a tiny story of manifestation. But the point is, I wasn't trying to manifest a solution to this problem with the use of this method. I'd kind of already accepted that given her lifestyle and how things are, it was inevitable that one day that would be lost. And here it seemed to have, I mean, it's been half lost before, don't get me wrong, but it seemed that this was the time it happened. I totally accepted that completely, and I had no expectation of changing it, and I was not trying to manifest. So that really piqued my interest. And well, I'll leave it there. If you want to read the book, it is really interesting. I'll put it up in the screen for you, because this background I've got on this lovely forest is a little bit tricky when you're trying to, oh, it's coming up yet. I seem to have it in the right plane of existence here. Zero limits. You can't see the zero too well. It says zero limits, the secret Hawaiian system for wealth, health, peace, and more. Joe Vitale, with the Haliaka Hulen PhD. And it's well worth a read. And I do suggest that you practice the hooponopono prayer or mantra or chant or however you want to call it, which is sorry, please forgive me, thank you, I love you.